So if you're diagnosed with prostate cancer, and now you've gotten over that shock, next you're going to learn that there's some people that get treated and some people that don't get treated. And the more aggressive cancers have to be treated. And then a big hard part of the prostate cancer journey is then deciding how to be treated. The two main categories of treatment are surgery. And I'm a surgeon, so there's that. And then there's radiation, and radiation comes in different flavors and protocols, et cetera. But one of the biggest things that I'm counseling people between those two, not only are they unbelievably different ways to solve a problem, but they have very different effects on your erections afterwards. And again, that is the big fear. That is the bad news to a guy when he learns he has prostate cancer, because we're mostly going to cure you if we catch it early, but everyone's going to go through trouble with their erections, at least for a period of time. So let me give you the basic compare and contrast between radiation and surgery that I give patients. And these days, it's probably one of the reasons why more people are choosing surgery these days than radiation. I've talked in another video, and I talk all over my website at dcurology.net about the time course of recovery of erections and the uphill battle there, and certainly what you can expect after surgery. But there's a lot less in the literature about what to expect with radiation. And some of that is just, I think, because there's less of an extensive discussion with a radiation therapist when you're talking to them about prostate cancer treatment. When you talk to the surgeon, it's something that I'm going to do to you. It's something I need you to know about. I want us to be partners, and I want you to know what to expect. And I find a lot of people don't ask the nitty-gritty questions of a radiation therapist. So let me help you here. First of all, I'd like to just talk about radiation when it refers to just radiation, which has become a very rare thing these days. These days, to make radiation just about or almost be the same cure rate as surgery, most radiation protocols, even the ones that are more minimally invasive, tend to involve hormone therapy. So we need to understand that. But if we weren't talking about those days, let's go back 5 years ago where they weren't doing that. It was sort of a basic compare and contrast of surgery will take your erections away immediately, and then it's a slow but consistent uphill recovery. Upwards of 2 years, it keeps getting better. And you'll get them back based on what kind of blood flow you have, what kind of shape you're in, are you still together horny-wise, and did you need help beforehand? Radiation is just about the exact opposite. Remember, we're not talking about hormone therapy. So radiation would be, you get the radiation and your erections are perfectly fine. And just about the time at the 9 to 12 month point where the surgery people are starting to get better, the radiation people start a slow and steady decline. So the surgery people have a slow and steady improvement over 2 years. Starting at about 9 months to a year, the radiation people start getting worse and worse, typically at 9 months to a year. And then that keeps getting worse and worse. And the surgery part has to do with, we just did surgery and that's going to be an immediate effect on, blood flow. Some would say there's an effect on your nerves. I'm not really one of those, because most people that do good robotic surgery don't hurt your nerves so much. Radiation, what it does, we've all heard of atherosclerosis or hardening of your arteries. That's the effect that radiation has on your arteries, and it's a delayed effect. And it can take 5 to 10 years to have that full effect, but it doesn't really start kicking in for 1 year or so. So that's why there's this delay. So that was always, so if you're an older person and you're barely hanging on right now with your erections, maybe you consider radiation as the way to go, because you won't lose them right away. And that one may not be your knockout punch. Maybe you can still use them for a year or two. Younger folks are going to care about what happens after 2 years. So they're going to tend to choose surgery. That's the clear winner in younger people. And that was the basic thing. There are minimally invasive ways to do radiation. The first way was called seed implantation. That's something that's done very rarely now. That's not a good procedure, has more side effects than surgery, and doesn't cure you as well. But you can still find that in some places. But there's always been a version of that minimally invasive radiation. Around here in DC, there's a place that does something called CyberKnife, which is very focused radiation. There's, implanted seeds that are removed. There's always going to be some form of more minimally invasive radiation. And they usually lag behind on the hormone therapy things. those will limit, for instance, CyberKnife, the effect on your erections, but it's not zero. So many patients are disappointed because they think they're getting a magic treatment. Nothing's zero. And when you choose something like CyberKnife, you have to understand that theoretically you're going to choose a lesser cure rate. So you're choosing less effect on your erections at the expense of likely lesser cure rate. And so I make that clear to patients. But the general idea of it's the opposite. Radiation, you lose them right away and recover. Surgery, you lose them right away and you recover. Radiation, you lose them in a delayed fashion. That's what I want you to remember. But now when we throw hormone therapy into the mix, that throws the whole thing out. The advantage of radiation was that you weren't hurt with your erections immediately. But if you have to have hormone therapy before then, you will lose your erections with hormone therapy. You'll also lose all sexual desire because your testosterone goes to zero. So really any advantage that you could have thought came from radiation over surgery has pretty much gone away in the modern era. And now if you have more serious prostate cancer, and we try now to limit treatment to more serious cases, sometimes the protocols are up to 3 years of hormone therapy. And so here's where specifically I find that in high risk cases, surgery shines, especially in the erections department, because you have a chance of getting them back. Whereas with radiation, you have practically no chance. They're giving you the highest dose of radiation and they're taking away any early advantage by throwing in hormone therapy. So those are the basic tenets, at least in the erectile dysfunction department between surgery or radiation with prostate cancer. If you want a more in-depth compare and contrast from a cancer treatment point of view, go to my website at dcurology.net.